Great. Okay. Thank you, Liz. I'm just going to add my welcome to Liz's welcome and a little bit reiterate. We're going to talk today about introduction to Connecticut balance of state, which we call CT BOS, continuum of care, which we refer to as COC. So we're already starting with the kind of alphabet soup of our own language, which is part of the reason we do this presentation, because there is so much to grasp, that there's so much that's unique to HUD, the Department of Housing and Urban Development, where we get our funds from, and it's ever evolving, right? There are sets of rules and regulations, and they're ever evolving, and so that's some of what we're going to talk about here, HUD, and then what is specific to our continuum of care, our CT BOS. Please feel free to use the chat to ask questions, or raise your hand and we'll try to get to that, and you can unmute if you have questions. We'll see how, if time allows, we may have to hold questions till the end, but if we don't get to some questions, always feel free to email us or contact us, because like Liz said before she started recording, this stuff is not always intuitive, and there's a lot of nuance and rules and regulations to all of it. So yeah, no question is a dumb question. I have two screens going on here. Let's see. So this is what we're going to talk about today. The primary target audience is the steering committee. We're not going to get to the nuances of grant management for recipients and subrecipients. There's information and trainings on that on the CT BOS website, which is ctbos.org. On the trainings page, there's a ton of good information there. So we recommend that you go there if you are at all new or looking for any information on the COC, because they're really good resources there. So CT BOS, an overview of the homelessness response system, key partners within our COC, some of whom are here today. And I would invite you, as we're going through, if our partners have anything to add, please feel free to stop us and add that. Governance, excuse me. So some of the rules and regulations that go along with the COC that are particular to us, or rules that HUD tells us we have to follow. System and project performance, the continuum of care competition, and then there's resources at the end. So we want to start with introductions. Liz, are you able to do breakout rooms? Actually, how many people are 34? Yeah, we should do probably breakout rooms.
Yes.
So, okay, in the breakout room, there are 33 people here, so we're going to break you out. We ask you to answer these questions. What's your current role within the continuum of care? For instance, are you a steering committee member? Are you a CAN representative or coordinated access representative, case manager, community rep, a CLIP, which is a consumer leadership committee consultant, or a provider? Oh, I can hear someone. I ask that you all mute yourselves. Okay, thank you. How long have you been in your current role, and what questions do you hope to get answered today? I'll give you a few minutes to answer those and then bring you back here. Okay, you should have a button to click to join a room right now. See if. All right, I hope you all had some nice introductions in your breakout rooms. Does anybody want to shout out things, questions they hope to get answered today? And hopefully we will get to those. Or put it in the chat.
I had just asked about why there are two continuums of care for Connecticut instead of just one big
That's a good
statewide.
question. Yeah, HUD, especially in recent years, has asked, like, I'm going to talk about this coming up, but like it's a requirement to get the HUD funding to have a continuum of care. But um, communities get to decide how they do that, who's a part of that, who's not a part of that. So HUD has definitely encouraged areas to consolidate because you get efficiencies with larger groups, but not everybody wants to do that. Some people have their own way of doing things and feel that their areas have very unique needs that need to be addressed a certain way. So it's kind of people's individual choice. So over the years, actually, Liz has been here many years. And Connecticut has gone from, go ahead, Liz, you can
Yeah,
speak
maybe
about
15 back in the day. So Hartford, New Haven, New London, everyone had their own COC. So in the last 20 years, it has been consolidated down to two. Yes. And then, like some states we've talked about, like Florida has dozens, but then Nebraska maybe only has one or two. So it just depends on the region, but it's a great question.
that.
And every couple of years we talk about it. Because we aren't a huge state, even though we get a lot of money. Yeah, but we have two for now, and two is, like I said, a huge benefit from not having 15 anymore. Yeah,
Yeah.
great
And
question.
I don't know if I said this in the beginning, but the information we're going to go through is dense. So if you're not getting everything that I'm saying the first pass, the slides are already posted. Liz has posted a link in the chat box, and we are going to post this recording on the website. Usually we do that within the next 48 hours after we actually do the webinar. So if you're not getting it, if you're like me, where you're still processing the last thing somebody said and I've moved on to something new, don't worry, the information will be saved for you. So we're going to talk about an overview of CT BOS. What is a continuum of care? It's a group of individual community members coming together to prevent and end homelessness. So as I just referred to, first and foremost, HUD requires communities to have a continuum of care. This organization, that's what they call this organization, in order to get HUD funding. The continuum of care is designed to help people who are experiencing homelessness, help provide services needed to the individuals and family members. My cat has something to say about this. Move into temporary and permanent housing with the goal of long-term stability. It's designed to really promote community-wide planning, to have as many different factors, individuals, voices heard as possible who can give input on these programs and how we work to end homelessness in our community. It's designed to improve the coordination and integration with all mainstream resources and programs targeted to people experiencing homelessness. And another thing that the COCs are charged with is improving data collection and performance measurement. We'll talk about that a little bit coming up. Allow each community to tailor its program to the particular strengths and the particular challenges each region faces. And as Teresa, I think, just asked, why do we have two? We have two in Connecticut. We have CT BOS, which is all of the counties in Connecticut except for Fairfield County, and Fairfield County has opening towards Fairfield County, which is in the southwest region of Connecticut. Other key responsibilities are identifying gaps in the system, using information to evaluate, improve project and system performance, establish policies. As I said, HUD has lots of rules and regulations to follow, so to put those all in one place, and then layered on that, there are state and local provisions. So we put all those in place for people who are providing assistance to the people experiencing homelessness. Establish policies governing the funded projects and decision making, and ensure assistance is fair to everyone. So, for example, we look at various issues. Are there And I'm going to talk about our point in time count coming up, where we look at how many people are living on shelter. Do we need, and then talk about solutions for that. Do we need more emergency shelter? Do we need more outreach staff or programs in order to get people into shelter or into more permanent housing solutions? Are there longer lengths of stay in emergency shelters? And to solve that, what are the issues that lead to that issue, that problem? Do we need more permanent housing options? Do we need more housing navigators to help deal with landlords and find affordable housing and negotiate with landlords? Do we need more people to help at a different level to prevent homelessness, to prevent people from coming into homelessness, to help navigate relationships with families or landlords where people can stay in their housing and not have exits to homelessness? So those are some of the things that we look at in terms of gaps and solutions. The other key responsibilities, as I said, helping projects understand the federal and local requirements, ensure that we have an effective coordinated entry system. I'm going to talk about that coming up. Homeless Management Information System, or HMIS. That's our data system. We're going to talk about that coming up. Help coordinate the point in time count. I'm going to talk about that coming up. And how we help coordinate our reporting, which is required by HUD. All right, the funding that Connecticut Balances State receives every year from HUD. Our total annual funding is 64 million. Earlier, when I was going through these slides, I said 64,000. I'm not used to these big numbers. 64,800 and almost $67,000. And here's a list of all of the funded activities, and we're going to go through a graph coming up where you'll see the breakout of those funds. So as you can see, permanent supportive housing and rapid rehousing are our largest portion of funding. In recent years, we've added more and more rapid rehousing. I'm going to talk about what each of these is, what they entail in upcoming slides. But the combination of permanent supportive and rapid are considered permanent housing options by HUD. So that's by far our largest portion of funds. Then transitional housing is another part, that transitional, and then the joint PH, which is rapid rehousing, and joint transitional rapid rehousing programs. Those are small portions of what we do, and they're mostly geared towards people who've experienced domestic violence. You can see we receive planning funds, outreach funds as well. So it's only a few minutes in, but is there anything that we've covered so far that you are hoping to learn more about?
Yeah, and we're just going to talk through this quick. Did we talk about anything that doesn't make sense that you want to know more about? How about something that's fascinating? The scintillating stuff, anything? Right.
I could see also Rob said in the chat, some areas here like Manchester still call the monthly meeting the Manchester COC. So that's a holdout, yeah, for when we used to have that individual COC.
Absolutely. And it totally makes sense that smaller regions meet, and in a little bit we'll be talking about the coordinated access networks, or the CANs. And so that's yet another way that regions break down. So there are lots of ways for localities to get together in smaller groups, but yes. So we'll allow you to call yourselves the Manchester COC. I think that's whatever makes you happy, Rob, is awesome.
Teresa saying the breakout of funding is fascinating. Yeah, yes, it is. And I will say PSH is the thing that we've been able to submit funding for the longest and get bonus projects for. So that's part of that as well. Alina, 0% funding for HMIS. Yes, there is funding. It's not zero, but it doesn't add up to a full 1%, right? For HMIS. So while there is funding, we probably could use more for HMIS for sure. Rapid rehousing is something you want to learn more. We are going to talk about that further.
Yeah. And Teresa, you're right? So there's so much money to go to PSH, and yet it's tough to qualify for PSH, right? So that is interesting. And it's an
It is
expensive intervention too.
exactly. Those are the people we're going to talk about each part, and they are the people who have the greatest needs, people in permanent supportive housing, because you're required to have a disabling condition, be unhoused, or have a long history of homelessness. So, but there's many factors that go into that. And I'm going to talk about the youth also.
Yeah. Can you go
Show
back
the
just to
slide
the
again.
funding? Do you want to go back? Yeah, oh, I'm sorry. You know what? I apologize. I didn't catch that. The HMIS got rounded. Right. So
Yeah.
I'll find what it is. I want to say it's like 0.7% of it, but it's certainly not zero. So thank you. That needs to be corrected.
Is there anything you can elaborate for homeless to house programs? I'm not sure. I'm not sure what you're referring to. Go ahead, Liz, if you have
Is that
something.
the H2H program someone's asking about? Because we have Ebony here. Ebony might be able to tell us a little bit. No?
It might be. If you could just clarify if that's what H2H program. Yes, okay.
Ebony is
Ebony, are you able to speak to the homeless to housing programs?
Yes, ma'am. So
putting you on the
Sorry.
spot, Ebony.
I see. So what I do as a homeless to housing specialist is a part of the coordinated access team, the outreach team. I follow the housing first to harm reduction models by assessing and working with the people that are experiencing insecure housing or homelessness. What I do is I engage people, and sometimes I have to actively canvas and look for people. I help them with the process of helping them get their homeless verification paperwork together, or try to help them backtrack at least their history for the past 3 years, because you don't go back past 3 years in order to be eligible for a PSH of homeless verification forms. Also, I help to get them engaged with any kind of clinical or person that they haven't worked with to get their disability verification, because a lot of the DEMIS housing programs, you have to have both. A lot of times they're worried about carrying around their backpack with their items, so I keep a folder together so that if they do come along these items that they need to be housed, like ID or social security card, I can hold on to that. And if they need it at any given time, I can give them either a copy of it or provide them with it, and they bring it back. Sometimes what I have to help do is to determine if they're chronically homeless or like a dedicated plus eligibility for certain housing criteria.
It's great. That's a lot. It sounds like you're very busy, Ebony, and that's a great overview. Thank you of the program, and it's also fairly new too. So it's great to hear about that. Thanks, Ebony.
If I'm not mistaken, I think I'm the only one doing it right now. So yeah, I'm flying by the seat of my pants with this job.
Sounds like you're doing a great job of getting a lot done, boy.
Thanks for the work you do. Yeah. All right, so we're going to talk about an overview here of the homeless response system. Core components, 211 is really the front door to the homeless services system. It is where people call to get help. It is a program, it's a United Way of Connecticut program funded by Connecticut Department of Housing. So as the slide says, it's a one-stop connection to local services, utility assistance, food, housing, etc. And more. So for additional information, you can click the link on this slide. And then coordinated access network, which we kind of use, HUD's term is coordinated entry. For Connecticut, that translates into our coordinated access network. So each CAN region, which the next slide is going to show you all the CAN regions, has their own CAN. their own organization that serves as kind of a funnel for people to, or actually the front door of the COC system, the front door of getting into housing for people who are experiencing homelessness. And more information for that can be found at this link.
Yeah. And you know, so folks who have been around a long time remember, and I guess it wasn't that long ago, when, you know, when somebody wanted shelter, depending on the shelter, you would stand outside. It might be very hot, very cold, rainy, snowy, etc., for hours waiting to get into shelter. And then maybe there was space for you and maybe there wasn't. And you had to be strategic that maybe this shelter had space and this is a good spot in line. And so when you know, HUD really started to push coordinated entry and Connecticut was definitely on board. It just made a lot of sense to try to create a fair and equitable system. And I know people, so the downside people will say is, yeah, but at least some, you know, if you had a good place in line, you knew you were getting there that night. Now you may not be able to get a shelter bed that night and there's a wait with 211. So people talk about the pros and cons, but the idea really was to create a fair system, an equitable system, not have people standing outside in line, and to be able to gather information so that, you know, additional help could be provided to people. So just a little history there.
Yeah, so as Liz was talking, that was some of what I was going to say on this next slide. So this is a good graphic to show you how the CAN system works, right? So it used to be, before we had the CAN system, people who most likely got help were those who had a case manager who had been around a while and were really good at their jobs, or really the individual was super savvy about the system, knew where to go, what to say in order to get what they needed. The people who are the best self-advocates jump through hoops, background checks, drug screens, interviews, know the right things to say. And a colleague of mine used to say when she was telling people to go get help, you say this: I have schizophrenia. I know that I have to take my meds exactly, right? Because before the days of Housing First, some providers would look for people who were compliant and maybe easier to deal with. And now it's a much more equitable system. People get a standardized assessment to determine the level of need. The CANs know all the programs that exist, who each provider serves, how many vacancies there are, and knowledge when possible of upcoming vacancies. They help as many people as possible tap into all the available resources and avoid, if possible, going into shelter or being on the streets. They keep a by name list of everybody who needs help, including people who would go into different tiers of assistance, people who need rapid rehousing, people who need permanent supportive housing, that type of thing. And they prioritize people who have been homeless the longest and who have the most intensive needs. And they really work together to find creative solutions and to help get people with tons of barriers housed. And one thing in recent years we have used the CANs for is if somebody is in one of our programs, especially a permanent supportive housing or rapid housing program, and are having trouble staying stably housed, they will meet and convene with the CAN and kind of discuss best options for this person, brainstorm with the people with the different knowledge bases, and talk about what we can do to best help the person stay housed. Okay, homeless management information system. This became a requirement back in 2004. And prior to that, people were really, they were using educated guesses, but that's really what they were, to report things like the point in time, like how many people at any given time in their area were experiencing homelessness. In fact, when I first started doing continuum of care work, some of the agencies I worked with who had been around since the beginning of the continuum of care funding said they would all sit around a conference table and talk about what numbers sounded best from their experience, from their program's experience, from what they had said to HUD last year. And that was what they would put forward as who was experiencing homelessness, or the number of people every year. Now we have an actual database, which has been improving from year to year, where all of that data is input. It's no longer a guessing game about the numbers of people experiencing homelessness. So outreach programs, all these continuum of care programs, people who receive ESG funding, Emergency Solutions Grant funding, which is many of our shelters, are required to use this HMIS system. Data uses we use the data for CANs and for service coordination and for these system performance, point in time and housing inventory counts, which we'll describe what they are coming up, and APRs, which are annual performance reviews that every program has to submit to HUD annually, and renewal evaluations. Connecticut Coalition on Ending Homeless, CCEH, Rose Kelly, I saw you here earlier. Thank you for all your hard work. They are the HMIS lead for CT BOS. Project types. Permanent supportive housing is targeted to people who've experienced homelessness the longest and who have the most intensive service needs. HUD requires people to have a disabling condition to enter permanent supportive housing. And it pairs the resource of housing, rental assistance, with supportive services. And this permanent supportive housing is not time limited, although if people don't, if people don't need this intensive services anymore that come along with permanent supportive housing, we like to encourage them to move on to a different resources such as public housing, which might be available to them and meet their needs, but it is not time limited. Rapid rehousing is designed to provide quick access to housing through rental assistance and supportive services. It's a short or medium term intervention. Families, households in rapid rehousing are reevaluated regularly to assess their ongoing need. And in CT BOS, the time is limited to less than 12 months of people receiving assistance, but exceptions are possible if necessary. And with coronavirus in the recent years, we have had to extend a number of people in rapid rehousing, but you cannot go over 24 months according to HUD regulations. Transitional housing is a temporary supportive housing, so it pairs rental assistance or it can be in a structure that the organization owns that supports people's living situation and then connects people to services. The goal to be, but it serves as a bridge between homelessness and permanent housing. The goal is for people to be in temporary transitional housing for less than 12 months. And most of our transitional housing in CT BOS goes towards special populations such as youth or people who've experienced domestic violence. Supportive services only grants are for, and then there's SSO coordinated entry. So these are grants that aren't linked necessarily to the housing, whereas the previous three are linked to housing as well, but they provide people the support in order to sustain housing, in order to possibly obtain like what Ebony was talking about, what she does, although that's not a supportive services only grant, it could be. That's a good example of a model that could be a supportive services only grant. People can meet people where they're at, help them get prepared to be in housing, and then help bridge them into a more permanent housing situation. And then there's some supportive services only grants that support our CAMs as well. And then there are the HMIS grants, and we talked about those, and COC planning grants support COC operations, creating rules and regulations, helping organize, can provide backbone supports for continuums of care. YHDP, sorry about that. YHDP grants are relatively new, but they only became available in the country in 2016. And that year we applied, and we were one of only 10 communities nationally selected to be the first round of YHDP projects. So that's part of why those resources are lower. The projects actually started in 2018. So the types of YHDP projects we have are listed on this slide. The largest portion of YHDP is rapid rehousing for youth, but there are these other grants that we are able to run just for youth as well. The Connecticut Department of Housing is the lead for YHDP projects, and there's a link for more information on them. Literally, Teresa's asking what literally homeless means. Did I say that? Literally homeless is a HUD term, and that means people who are experiencing unsheltered homelessness, right? So people who are living outdoors, people who are sleeping in their cars, people who might be sleeping at a bus station, a place not meant for human habitation. That is what HUD considers literally homeless. And then also there's sheltered homeless, which is also considered literally homeless, and that is people living in emergency shelters and also transitional housing, since that is such a temporary resource.
And there's a question too, if folks coming out of correction are able to access the programs. So obviously anyone who's experiencing homelessness is able to, but the idea is that if folks are leaving a hospital, a jail, a prison, that they have a discharge plan, and that it does not include coming to shelter or using any of the resources that are meant for people experiencing homelessness. Unfortunately, sometimes people from, corrections, from jail, from prison do become homeless or start experiencing homelessness. And then they certainly can be served. But HUD for years, which they've moved a little bit away from, has always asked us to explain to them and basically promise to them that we have discharge planning in place. And so that we don't have people leaving jails, prisons, hospitals, other institutions, and kind of, getting put into this system.
Yeah, so the literally homeless question is kind of related to that question about Department of Corrections, because for all of the COC programs, people are required to fit that definition of literally homeless, which the people coming out of the correction system don't fit that definition. Thanks, Liz. So core components, more information, domestic violence, rapid rehousing. In the recent several years, HUD has made available specific money, a specific pot of money only for survivors of domestic violence. So we have several rapid rehousing domestic violence projects, and those are administered through CCADV. We have a slide on CCADV coming up, and I think we have some partners from CCADV here. We're happy to have you here, and if there's anything you'd like to say, we welcome you to say it. With those rapid rehousing grants, services are provided and coordinated by CCADV through 19 domestic violence organizations throughout the state. There's also joint THRH programs. There is actually only one in the state where it combines the resources of transitional housing with rapid rehousing, but the length of time for that program is still only 24 months that you can be in that program. Prevention and diversion is pretty self-explanatory. This occurs at the CAN level via 211, and people at that level work, as I was referring to before, to kind of mediate a situation to help prevent a person from entering homelessness. So they might give a food voucher or utility assistance, or connect somebody with some very temporary rental assistance to help them stay where they are. They could work in mediation with a landlord or mediation with family members to either help them stay where they are or move somewhere else that's a safe location for them. So that's our prevention and diversion resources. They are not funded by the continuum of care funds, but they are an important part of the continuum of care. outreach is also, it's partly funded by other resources as well. So outreach helps to engage people living unsheltered into services and helps to move them along the road. Some of what Ebony might do might be considered outreach depending on who she's working with. Help build relationships with people, build trust with people, so we can help them to get the documents or whatever they need necessary to get into housing. So some of the people or projects that provide outreach services are PATH projects, projects for assistance in transition from homelessness. Those projects, PATH projects, serve people with serious mental illness, including those with co-occurring substance use issues. And right now there is one PATH project for CAN. It's funded by SAMHSA and administered by DEMAS, the Department of Mental Health and Addiction Services, in Connecticut. We also received recently some supplemental NOFO. This is more HUD speak, but that's our annual competition. We call it the NOFO. A couple of years ago, put out funding availability, for the first time for outreach. So we have funds in all 6 cans from that. That is just kind of moving forward now for outreach. Some communities have outreach teams in addition to PATH, and then DOH received some coronavirus stimulus funds that went towards outreach. And there's a link for outreach trainings there. Emergency shelter, pretty self-explanatory also. It's a short term, it's really intended to be short term, right? Because this is, it's an unstable time, and we like to keep that lack of stability kind of as brief as possible and link people to more permanent solutions, link people to services where they can move forward in their lives in a more stable situation. So hopefully people are getting things in shelter that help link them to income or help link them to food, those types of things, so they can have more security in their lives. They meet basic needs: shelter, food, safety, and hygiene. And most shelters do offer some level of case management, or it might be a situation where they're getting case management from Ebony while in their shelter, who is helping them to find a more permanent solution. As I said earlier, most emergency shelter in Connecticut is funded by ESG funds through the Department of Housing, and there are some private sourced emergency shelters. Key partners, I think I'm handing over to Liz now.
You are. So before I move on to key partners, questions, comments, concerns, anything? No? Okay. Well, we'll continue on with our alphabet soup and key partners. Also, caveat is that we're not going to list all the key partners. We have so many great people doing lots and lots of great work. So we just highlighted a few here. Okay.
I'm sorry, I'm next slide.
No, okay. There we go. So we will start with HUD. And when we think of HUD, or our bureaucratic world, when we're talking about COC stuff, at least, we think about our friends in DC. So the Snappers, which Shannon and I are very jealous that they have a really fun nickname and we don't. So we could also, if anyone thinks of one, you could put that in the chat. That might be more fun than what we're talking about. Anyway, yes. So the Snappers are our friends in DC. Who put out the notice of funding opportunity. They score us, they answer our questions, they provide guidance to both to us and to the field office folks. So we deal with them a lot when it's competition time. And when I say deal with them, we might send a question through the system. They might have a webinar for us. So that's kind of, those are our Snapper friends. And then Hartford field office is really important too. And you guys deal with them a lot, obviously. So anything that's wrong with your grant, any question you have, you're going to touch base with them. They work really closely, obviously, with the grantees. So the grantees are the people getting the grants. They also are in charge of monitoring grants, and they assign a field office person, staff person to do maybe different groups of projects or areas in the state. So you may not deal with the same field office person or staff person. But those are our friends, yeah, at HUD. So we also have lots of key partners at the state, but we're going to talk about DEMIS because DEMIS is what HUD calls, in HUD speak, the collaborative applicant. So they are the folks who are in charge of submitting the application to HUD every year. Housing Innovations, along with lots of other folks, put together the application, but DEMIS, they are the folks who hit submit. So we work very closely with DEMIS. They also oversee a lot of the work that we do. So Housing Innovations has a planning grant, CCH also, so they're overseeing all of that work. DEMIS has probably about 60 PSH projects where they are the grantee. So the grantee gets the money, and then there may be there are service providers, and then that they are contracting with as subrecipients or subgrantees, but DEMIS has the bulk of a PSH, or probably at least half the projects. DEMIS is the grantee. And then folks know DEMIS does lots and lots of other things in our little world. We think about the housing piece they do, but as you know, DEMIS does lots and lots of work throughout the state, providing all kinds of behavioral health services. Shannon mentioned before, they have outreach programs through PATH. And Alice Minervino, who I bet everybody knows here, is so fantastic. And we work really closely with her. She's just has so much information and is kind and wonderful. So we can't, and she is one of our co-chairs, which is really great. We're going to talk just for a second about DOH. So we have Steve, who also has been around for a long time and is fantastic. He's one of our co-chairs. DOH does lots and lots of things. So DOH has a lot, I don't know how many, but many rapid rehousing projects where they are the grantee and other folks provide the services, and ACT provides the rental assistance. They're in charge of overseeing the CANs. They help fund 211. Shannon mentioned before, emergency shelter grants, they're in charge of that. They have some moving on vouchers and other support affordable housing. Some of you deal with them with RAPS, the rental assistance programs. They do Unite CT. They have some outreach funding, and they are super busy people. And we're so grateful to have Steve and his other staff people work so closely with us. So now we have CCH, and I know we said we have Rose here. Another great partner. We do so much with them, and they're in charge of a lot of things. They are our HMIS lead. They are leading I keep saying everything's new within the last year or so, Connecticut Can End Homelessness campaign. And check, I think we give you some links, check that out. They're doing great advocacy work. They oversee Nutmeg, and Nutmeg, as you guys know, are in charge of the technology, the HMIS help desk, and they are fantastic partners as well. CCEH helps staff the HMIS steering committee that makes policy decisions on what we're doing with HMIS. They have lots of trainings, and they just do a ton of stuff. And Shannon also just told me that Sarah Fox is speaking at the NAH conference. So that's exciting. Great.
There's the executive director.
Oh, I'm sorry, she's the executive. So another key partner, so we just talked about the HMIS steering committee. So CCH staffs this, and we have an HMIS steering committee, as I just said. So we want to know what we're going to do with HMIS. So they help decide what are the principles. So what's going to guide us for HMIS implementation. They're in charge of policies and user agreements. So the providers on the call here, you guys know that you need to enter into an agreement with CCH to have a functioning HMIS system.
Like every month, we do something different.
That's okay. They advise CCH and the BOS steering on a whole bunch of issues, how we select who's our HMIS software, other vendors. They help look at data quality benchmarks and decide what we're going to look at and what's important there. And they are always very busy reviewing and prioritizing the many requests that come in for I'd love to run this report. Can I get these data? What can I do? And there's a lot going on there. So we're glad to have them doing what they do too. So I mentioned ACT before because they are the rapid rehousing rental administrator. And John Mertz is on our, he's a steering committee chair. And ACT does a lot of different things. So again, in our little world, we think of them as the rental administrator, but they actually provide a ton of different services. They work with people who have been impacted by HIV and AIDS. They work on health issues, housing, and do lots and lots of good stuff. Keep going. Shannon mentioned CCADV. So we do a lot of work, especially in the last 5-7 years when the DV bonus came about. I don't remember when, but the last 5 or 7 years where there's been a lot more money available, a lot of funding available. And there's been a lot more rapid rehousing out there, which is fantastic. Again, we think of them in our world with rapid rehousing and housing folks, but they do lots and lots of other things too. And they are the coordinating entity for, I know we have Yolanda here. I know it's at 18 somewhere, 19 somewhere. They've got lots of member organizations. They're in charge of kind of overseeing and helping, and they do great advocacy work as well. And we have CSH. They are also on the steering committee. And they are a national not-for-profit, and they have a Connecticut office, and they are always promoting supportive housing. They actually will do lending for a project. They do consulting, they do policy reform, and they do lots and lots of really good trainings. And they are in charge of the CLIP program, the Connecticut Leadership, I get it wrong, CLIP, Connecticut Leadership, Involvement Project. I was going to say it's not written there right. We'll correct that. Which has been great. It's been pulling together people with lived experience of homelessness to consult. Oh, thank you. To consult with the COC and do really good work in providing recommendations and feedback on processes and products that we have at the COC and making sure that we have a lot of different voices at the table. So CLIP has just been fantastic. I think we are in the third cohort. And CSH coordinates folks, and they've been an amazing addition to the COC.
I think Emma's saying they also conduct permit supportive housing DEMA's contract quality reviews.
Yes. Oh, thank you.
Yes.
We'll add that bullet too.
Yeah. So we got like 10 emails from them last week. So just it's a good reminder.
Thanks,
Yes.
Emma.
You're welcome. You're welcome.
Absolutely too. Thank you. Our friends at Partnership for Strong Communities, so they are a not-for-profit, and they are working on changing housing policy to try to advance, I'm sorry, I'm not saying this right. They're advancing research, and they are working to make sure lots of voices are at the table and that everyone has safe, stable housing and affordable housing. And they're doing really great advocacy work. And you probably heard a lot of what's going on right now with them in the news and the legislature. So we're a key partner too here at Housing Innovations. So what do we do? So Shannon and I work for Housing Innovations, obviously. So one of our big jobs is to staff the continuum of care. So we help write the policies, we help make sure things keep moving, we have meetings. One of our big jobs is to do the HUD application every year, which really is now a year-round process. We do monitoring. So some of you may have seen Shannon out. We are in charge of the renewal evaluations every year. So checking in to make sure the over 100 projects that are funded by HUD and through the HUD COC program are kind of doing what HUD wants them to do, doing what we want them to do, doing what they want to be doing. We have a website. We're always trying to maintain that. And we do partner with CCH on system performance measures and Nutmeg with HIC and PIT, the point in time that Shannon just talked about. We have a role working on that as well.
We harass you all about that.
I was just going to say. I'm going to talk about governance in a second. Any questions on key partners? Okay, great. So governance. So this is what sort of rules the COC when we don't know if we're doing something right or we don't know how to do something. We say, go check the governance charter, go check the bylaws and see if we've written something to help us with this. Ooh,
Sorry, you want me to go back?
no, I mean, oh, that's fine. I don't need to say anything else. Yeah, so that's fine. Yeah, good enough. I know we do need to keep moving too. Thank you. So we have steering committee members, and the steering committee members help keep us in line, make sure we're doing what we're supposed to be doing. These are the folks that are voting on policies, voting on funding, voting on all kinds of different things. And so I'm going to talk about who makes up the steering committee. We hope that all our steering committee members come to each of our monthly meetings. And then also, though, which is very important, all of our monthly meetings are open to anyone. So you don't need to be on the steering committee to attend. And we have lots of other great partners and great people participating that are not on the steering committee, and that's really helpful too. But we just wanted to make sure you knew who's on the steering committee. I'm not going to read everything, but these are our community representatives. I know some are here today, so thank you.
And if people want to join the steering committee meetings, the link and the date and the time is all on the CT BOS website.
Yes, thank you. And then we have a whole host of government and not-for-profit agencies that are also on the steering committee. And I'll let you look at those for a second. Okay.
This is just where we try to really cast a broad, like get all the voices at the table, right? Because every voice has a different perspective and different expertise. So we really draw on everybody to give us the most informed kind of opinion to make decisions about how we're moving forward as possible.
Absolutely. And then, so we talked about government and not-for-profit folks, we talked about community reps, and then we have CAN reps. So we have 2 representatives from each of the CANs on the steering committee. And so we ask our CAN members, you can keep it there, it's fine. But what's really important about our CAN folks are they are the folks who are often at the Manchester COC meeting. They're the folks who are kind of on the ground doing lots of meetings with people. And so we ask them to send our emails, ask questions of other providers and say, does this make sense? Does this work when we have a vote? So what we do in the steering committee is we'll present an idea of something that needs to be voted upon, a new policy, something that has to do with funding. And we ask everyone to ponder and come back and vote a month later. But with our CAN reps, our real hope is that they take it and they are the folks who are taking it back to their communities, back to the providers. So other things that we ask our steering committee members to do, we really love everyone to attend meetings because it's hard to kind of pass information along, make decisions if you're not there. And to be informed and know what's happening. And then we talked a little bit about what BOS does. So we ask that our steering committee know what's going on, help us make decisions on the point in time count, what's happening with HMIS, to do planning and advocacy so that we're all working to end homelessness together. Project and system performance reviews. We ask folks to get involved. Again, every year we're writing our HUD application. We might come to steering committee members for some assistance there. I've mentioned policies, so weighing in, providing feedback, and then ultimately voting and making decisions on what our policies are. Looking at where there are gaps in the system. So every year we have conversations before we put out a new request for proposals to say, what's missing? Where do we want to spend our money in the system? And provide direction to us, who we staff the steering committee. And we ask everyone, obviously, to follow all the rules and the code of conduct, which we'll talk about in a sec, or right now. So everyone is asked to follow the BOS code of conduct, which is to make sure that there's good decision making, that we're all being professional, that there's equity and inclusion for everyone. And if you want to know more about the code of conduct, and we'll talk in a minute, also the conflict of interest, there is one document, and you can go to that link and check it out. So the code of conduct, it was created so that we could make sure that when we're all working together, we are trusting each other, we feel good about the decisions we're making and we're making them with integrity, that we're accountable to each other, that we're accountable to the people that we are serving. that when something comes up, we're all transparent because people are going to have conflicts of interest. It just happens, but that you make people aware of it. And then we may ask folks, or folks may know, to recuse themselves from a particular vote or decision that is made. Okay. So we have policies around conflict of interest. So we obviously, if there's a conflict of interest or even the appearance, like I just mentioned, you would want to avoid voting on something or making a decision if your brother-in-law owns a building that was involved in a permanent supportive housing project that we're talking about funding potentially. And there are lots of different conflicts. And what we do in the meetings is we talk about them. We make sure that people feel comfortable saying, I might have a conflict. And so far, so good. People are really open, honest, and that's the idea. So it's not that people shouldn't have conflicts of interest. It's just that if they exist, we need to talk about them and have people recuse themselves as needed. And all steering committee members complete a conflict of interest form. All right. And then every year we have elections. So we have elections for community reps every year. For CANs, we let CANs select their 2 representatives. That's just their choice. And for the agencies, we talked about the government and not-for-profit agencies, same things. They provide a representative and an alternate. And then we have co-chairs, so I've mentioned them. So currently we have Steve DeLella, Alice Minervino, and John Merce are our chairs. We have 1 vacant position, and we are actually coming up. If you have anyone you're interested in nominating, you can send that to our email, which I think we have some at the end of our thing, or I'll put it into the chat. And what we do is they serve 2-year terms, so every year we're voting on 2 of them. Yes. So Shannon was talking about how to join steering committee meetings. The information is here and it's always on our website. So you can check out when the meetings are happening. And if you want to get emails so that you can hear all about all different things BOS, and you can actually choose which category you'd like to be part of. So if you only want to know about steering committee meetings and things, you'll only get those. If you want to get emails that providers get that have to do with trainings and things relevant to providers, you can choose that. And as I mentioned, we meet monthly. It's generally the 3rd Friday. If there's a holiday, we switch it up. It's from 11 to 12:30 and it's open to everyone and it is still on Zoom. Oh, Tania, did you have a question?
Oh, sorry.
Yes. Hey, so I was just wondering, are there any specific qualifications to be a co-chair?
This is a very good question. I can send or show folks I'm hemming and hawing because I think we have responsibility of chairs, but we do not, it does not talk about what you need to, any kind of qualifications. No.
Okay, so anybody can apply, like even a community rep?
Yes.
All right. say
Oh,
less.
definitely.
That's all I
Yes.
need to know.
Yep. Anything else, Shannon? Anything? I haven't been watching anything in the chat we need to discuss.
I'm going to ask you after if
Okay.
you can post the slides to the chat again. That's all.
Oh, perfect. Okay, great. So
Oh, wait, the community rep is a 1-year position. That's a question. Community rep is a 1-year position.
yes. Yep.
Okay.
So yes. So every year we ask, so community reps are voted on every year. And then every year we ask the CANs to let us know who their reps are going to be and the government folks. But that's actually good you brought that up. If they needed to switch them out, they can switch them out at any time. But the election is annually for community reps. And then every 2 years, co-chairs serve for 2 years, but we vote every year, 2 of them are up. But those are 2-year positions. The chairs are 2 years.
Is there a way, how do people apply to be a co-chair?
Oh, you can nominate yourself or someone else and just send it to, you can send it to me, you can send it to my email, or you can send it to the CT BOS email.
Okay.
And those are due March 8th. And I'm glad you're asking questions. I will send the reminder out again. I think I sent something a few weeks ago, but I'll send another reminder. It
The
is not,
chair
I
is-
think someone said, is it paid? That they are not paid positions, no.
All right, renewal
Anything else?
evaluation.
All good questions. Thank you. Thank you. Good stuff. All right. Renewal evaluation. Providers are saying, ugh, we're in the middle of it. Everyone's been so great and patient with us this year and really every year. So HUD, we'll blame it on HUD. HUD does say to the COCs, you have to do this every year. So you have to evaluate projects or you can't get any more money from us. So CT BOS looks at, as you know, you guys do the providers here do consumer surveys. We take a look at spending. We look at performance, and we switch up the performance every year, what we look at. And if folks get low scores, they're required to provide a corrective action plan, just talking about how things can be better. And we do, if a project over and over again really struggles, they are at risk of losing their funding. But the BOS takes that very seriously and works very closely with projects and agencies to make sure that we can do everything we can. And that would really be the very last resort. Yep. And so we also do the renewal evaluation because it helps us create our list that ranks all the projects for when we submit to HUD and say, please give us our money. And HUD will say, okay, give us the order of the projects and how you want them funded. So this is a very bad math problem that goes on and has algebra and calculus apparently to really figure things out. But just for us with renewal evaluation, we're just going to tell you, we rank the projects based on how they score in renewal evaluation for the renewals. Great. And Shannon, I want to talk about your favorite thing.
My favorite thing.
Which we're also in the thick of, we're in the thick of all these things right now. Yeah.
Yeah. Can you please post the slides while I'm again? Yeah. Great.
Absolutely.
Okay. Thank you. Housing inventory count. We've referred to this several times already. So it's a HUD mandate that COCs count the people experiencing homelessness every year in their continuum of care. So we do it annually. It's two parts. It's looking at the inventory that we have of housing for people who've experienced homelessness, and then also looking at the numbers of people who are in that housing or who are experiencing homelessness at a single point in time every year. So HUD asks that it be within the last 10 days of January. So as Liz said, we just did it at the end of this January, but we are still collecting that data and still kind of parsing it out and making sure it's as accurate as possible before we send it to HUD. So we look at all of that pie of housing that we talked about in the very beginning of this presentation. We do by the numbers, how many beds, how many units are in each and everything for emergency shelter, transitional housing. And then we also do rapid rehousing and permanent supportive housing. The people in emergency shelter and transitional are counted as sheltered homeless. But the people in rapid and PSH are not, but HUD just still wants to know kind of the utilization rate, right, of what we have, of the inventory that we have. So that's what we're counting up and what we're asking for information from our providers on every year. So we also use we use data for it. The last few years we've used mostly HMIS data, or if not another data system, the PIT database, to collect that information. Whereas before we used to have teams of people go out and you're designated to each different region. But with HMIS, we've been able to kind of streamline that, and we use our outreach staff to look for, find, and count the people experiencing unsheltered homelessness, and then put that data back into HMIS or the PIT database for us. So this is the data that we've collected the last several years for the people experiencing homelessness. We haven't finalized this year's data, so that's not included here. But you can see the numbers, the total numbers of people from 21, 22, 23 here in emergency shelter, in transitional housing and safe haven. We put them together because they both have kind of lower inventory. Safe haven is a type of housing that really is not funded by COC funds, but the VA funds some safe haven housing that we have. The numbers of unsheltered from the last 3 years, the last year it was 434, and then the total, I have something blocking the total. The total number of people experiencing homelessness last year in 2023 was 2,413 in Connecticut that we reported to. System performance measures is another requirement from HUD. And instead of just looking at a snapshot at a point in time, this looks at the federal fiscal year. It goes from October 1st to September 30th, a whole year's period worth of data for our system. And it looks at COC projects plus some other street outreach, emergency shelter projects, and other projects that fit into those continuum of care categories but aren't funded. So it really looks at our whole system. And the measures are listed here: length of time homeless. So the goal is for us to help people be homeless prevent it first of all, but if they are homeless, be homeless for as little time as possible. So that's what we're looking at in our numbers, or trying to move towards in our numbers. We look at returns to homelessness. Are there our projects helping people to stabilize, or are they struggling even after they exit from our program? We look at the number of people experiencing homelessness, and we hope that that is reduced every year. But as you just saw from the pit, that can be a struggle, excuse me, especially with COVID, and especially with rents going higher and higher every year. But our hope is to reduce the number of people experiencing homelessness from the work that we do. Another metric is employment and income growth, because we all know when people have more money, the hope is that they can become more stable in their own lives and in their housing situations. We look at the number of people entering the homeless system every year, and we look at exits. Where are people exiting to? Are they exiting to a stable situation, or are people exiting to homelessness again? And if anywhere along these lines, numbers are going in the wrong direction, it's one of the charges of the steering committee, as Liz was talking about, to look at those gaps, look at where we might put resources, where resources are needed, or who can we coordinate better with, which is another resource, actually, not just dollars. Who can we better coordinate with to help our people get what they need? So this is all data we're talking about, right? So how is our data used to evaluate performance, system performance? The scores that we send into HUD annually impacts the NOFO, the COC competition score every year. And the better score we have, the more opportunity for new projects and new funding to come in. So these numbers really do matter, and HUD has been over the years increasing the percentage of data that they use in our COC score. So they're putting more and more weight on these numbers. Project performance impacts the continuation of renewal funding. It impacts the continuation of any and all funding. And both are used to continuously make the system more effective, as I talked about. Assessing system gaps, talked about that. Strategic planning, talked about that as well. The annual COC competition, we've referred to that a lot. It usually happens in the summertime. It has been over the past several years. It's usually about 90 to 120 day period from when it opens to when it ends. And HUD, this is where we submit all of our renewals. We submit any applications for new project funding. And we put together the whole big application for that where HUD asks us what we're doing, how we're doing it, whether we're following the rules, whether or not. We put that together and submit all of that together, renewals, new projects, and the COC application. HUD awards approximately $2.6 billion each year nationally in the HUD COC NOFO or COC competition. COCs across the country compete with one another, and really it's how they do this is congressionally mandated. I was just on a national call yesterday where people were complaining about, we all want people housed, why is this a competition? So the answer was Congress. There are three parts to the consolidated application, which I just talked about: COC application, project applications, and then the project listing is where, as Liz talked about, we are asked to rank every project. How are you prioritizing each of your projects, and what is most needed in your community? Did I skip a slide? Nope, that's it. There's lots of opportunities to learn more. There's the CT BOS trainings page to look at for any new and upcoming trainings. CCH does many trainings as well. Their event page is linked here. HMIS, of course, is always doing trainings, and their trainings page is linked here. DEMIS does trainings. They have their own portal catalog, and then after they do their trainings, we post their trainings to our page as well. So you can see them both places, but if you want to attend them live, go to that link on this page. CSH has trainings, and then of course the Connecticut Fair Housing Center is another good place to get training information. So staff is available at Connecticut Fair Housing Center to come to you and your group and explain the law, meet potential victims of discrimination, fair housing violations, and show how the services might help to obtain the housing that you want. In the past, the center has provided training to such groups as residents and staff at shelters, social workers assisting families with children, social service agencies assisting clients with housing searches, domestic violence advocates, and veterans advocates, and more.
They're great.
Any questions?
I see Emma has her hand up. Well, we could do Emma, and then I know there's a question in the chat from Teresa. Yeah, Emma, do you have a question?
Sorry, I'm always gonna have a question, Liz and Shannon. You know me. I'm sorry. Can you just
don't be sorry?
Can you just re-explain the intersectionality between? So like we just wrote to DOH for like rapid rehousing, for example. How does that play into the COC that we submit to HUD? So like we just competed for our rapid contract that comes from HUD, but then independently we apply directly to HUD for something like YHDP. And that's what I've always struggled. Like tomorrow we have the call for the 2024 proposals.
Yes.
Can you just explain this one more time for me so I can, because I know all my team is on it and I'd love for them to hear it because I don't think I explain it well when I try to explain it to them. Do you know what I'm asking?
Yeah.
I
Liz,
think
are you
so.
looking
I
something
think,
up, or you
yeah,
want
I'm
me-
pondering. So I think you are a sub-recipient. So DOH gets rapid rehousing funds from HUD. And then they say, hey, who can provide the services? Who's going to be our subcontractor? So they they have to apply, they apply, we'll say directly, but yeah, directly to HUD. They are the grantee, and then they are looking for subcontractors or sub-grantees for the project to do the services.
And then does that, and then that rapid contract that the state applies for goes into the overall COC application that you guys send to HUD?
There are specific individual project applications, and DOH has several really large statewide rapid rehousing grants for which they might have 6 or so sub-recipients and to do like each different region.
Yep.
So those, yes, DOH applies directly to HUD with those few grants. Yeah.
Thank you.
Great question, Emma. Great question.
It's just, it is when you're trying
It's
to
a
figure
lot.
out.
It's a lot. It's a lot.
So thank you guys. Thank you.
Of course. I think Teresa, you had a good question. I know, trying to align the funding with the people, which is so logical, but so you were asking, so we get 65 million between the regular competition, we get it annually, and then that Miles built in the SNOFO, which we got some outreach funding and some permanent supportive housing funding as well. They're not apples to apples on who we're serving. So Teresa was asking the question when Shannon was showing the point in time count, because the point in time count is showing people who are unhoused, who have, you know, so they may be, some of them are, utilizing shelter and transitional housing. So the COC, we don't fund any emergency shelters, and we fund some transitional housing. So some of that 65 million would fund the transitional housing, but that's it. So we don't fund the other pieces. And then we fund some outreach that hopefully is working with the people who are unsheltered.
I just
Did I miss
want to just
anybody,
say,
Shannon?
I know
Yeah, go ahead.
we're at the end of our time. And
Yes.
so if anyone wants to hop off,
Yes.
like, thank you for being here. We really
Yes.
appreciate you. If you're new, welcome. We will post the slides and everything. And I think we could probably stop the recording now, but Liz and I can stay on if